Good afternoon and welcome to Heart Matters with Dr. Celeste. We are excited to share with you on this beautiful Sunday afternoon about heart matters. So we're going to give it a few minutes to allow some people to climb on board. Again, I'm Dr. Celeste coming to you live on Facebook with Heart Matters. We're coming to you this afternoon from Atlanta, Georgia, and it's a beautiful Sunday afternoon. Excited to share with you again about some heart matters and how snoring can affect your heart. So we'll give it a few minutes to allow some people to join us here on our live stream today. I hope you guys are having a wonderful Sunday afternoon. I hope anyway, we're at the end or towards the end of the heat wave that has been going on. So we'll give it just a few minutes here to allow a few people an opportunity to get started, and then we will get started and share with you what we have going on today with Heart Matters. Good afternoon. Good afternoon. Hi, Miss Black. Good afternoon. Good afternoon. Hi, Miss Battle. Good afternoon and welcome. Thank you guys for listening. Good afternoon. Okay, we'll give it just a few more minutes. Again, I'm Doctor Celeste MD coming to you live from Atlanta, Georgia today. Excited to be in Atlanta today. Excited also to share with you guys again about some heart matters. Just another entity of some things that we should be mindful of that can affect your heart. Thank you so much, Miss Black. God bless you too. So we're going to go ahead and get started. So today's topic is OSA, also known as obstructive sleep apnea. And so the question today is, how can snoring affect your heart? Did you know that about 12 million Americans suffer daily with obstructive sleep apnea? And so this is an abnormality of the sleep pattern. And today what we're discussing is how snoring can affect your heart. So first, let's break down exactly what is obstructive sleep apnea. It is the partial or complete occlusion of the nasopharynx or oropharynx area. That's the area that's in the very back of your throat that occurs as a result of that partial or complete occlusion. Your nervous system is triggered to automate a response, wherein a lot of people will wake up gasping for breath and having palpitations, maybe feeling a little diaphoretic. So let's talk about some characteristics of people that suffer with sleep apnea. Unfortunately, a lot of people that have sleep apnea will suffer with daytime sleepiness. They'll suffer with fatigue. They sometimes will suffer with decreased concentration and memory issues. A lot of people will have headaches. Some people will suffer with high blood pressure as a result. So let's kind of talk about some things that we can do to help make this not be an issue. The first thing that we do is note that the first person that typically is aware that there is a possibility of obstructive sleep apnea in an individual is the bed partner. Because unfortunately, and what is true is that there are a lot of people that suffer with obstructive sleep apnea that are not aware that they even have a problem. So it usually sometimes is the bed partner that first acknowledges, hey, you've had some heavy snoring, or I noticed when you were asleep last night, it seems like you stopped breathing. And that is exactly what occurs in patients that suffer with obstructive sleep apnea. Your autonomic nervous system is triggered, and that causes the patient to wake up, and they usually will wake up gasping for breath again, a lot of times having palpitations, feeling diaphoretic. So if you have an individual, whether you or your loved one have been told, hey, you know what, you snore pretty heavy, and or that you stop breathing when you sleep. Now, snoring is one of the most common symptoms of sleep apnea, but not everyone that suffers with this unfortunate illness will have snoring as a symptom of the sleep apnea. So The first thing that you do, if you acknowledge that you have that, or your bed partner acknowledges that, is to see your personal physician so that you can undergo a full physical exam, as well as a test that's called a sleep study. The sleep study is a test when they attach electrodes. Hi, Brandy. They attach electrodes to your scalp, as well as a sensor on your heart to see what is your sleep rhythm, what is your heart doing during that sleep rhythm. Welcome, Mr. Davis. So, see your personal physician. You'll have a sleep study. Now, this is the main important part. So let's talk about treatment. If I'm someone that suffers with sleep apnea, what do I need to do for treatment? Well, the mainstay of treatment is called a CPAP machine. And so that's CPAP, C-P-A-P. And what does that stand for? It stands for continuous positive airway pressure. And what happens is that there's a gentle pressure that is exerted with this machine across your nasopharynx or oropharynx area to prevent that partial or complete obstruction that we spoke of just a little bit earlier. So, use of the CPAP machine will help to keep that airway open. Now, why do we care about that airway being open, or what happens to us chemically that would cause us to have any kind of risk with our heart? So there are two things that happen chemically. Number one is something that's called hypoxemia, and that's a decrease of oxygen concentration in your blood. In addition, something called hypercapnia occurs, where there's an increase in carbon dioxide concentration in your blood. These things can be dangerous because that low oxygen concentration in your blood, that sudden drop of oxygen in your blood during sleep apnea, increases your blood pressure, and it causes strain on your cardiovascular system. So let's talk about some of the risks that occur. In someone who has sleep apnea, you're actually at 140% increased risk of having heart failure. And someone that has sleep apnea, you are at a 60% increased risk of having a stroke. And in addition to that, you are at 30% increased risk of having a cardiovascular event. So if you are someone that already suffers with heart disease, this is something that can largely increase your risk of having a heart attack or having a stroke. So I implore you and encourage you that if you're someone that's dealing with these symptoms, you or your loved one, and please feel free to share this broadcast with them and share this information with them, because knowledge is power. I'm a firm believer in that. And I think that that's what we have to do. Hi, Dr. Carter Robinson. Thank you for joining. So in that vein, what we have to do, if you have heart disease, you already have a risk factor for having another heart attack. So if you have obstructive sleep apnea, it is something that can increase your blood pressure. There are other risk factors for obstructive sleep apnea, such as people who are obese, people that are overweight are more likely to suffer and have this kind of illness, obstructive sleep apnea. Someone that has large tonsils or a very thick neck are people that are at increased risk. In addition to that, someone that suffers with hypothyroidism, high blood pressure or hypertension, as well as alcohol use or sleep medications. So if you or someone you love is suffering with these symptoms, let's talk about our action items from our talk today. So people that have obstructive sleep apnea are at increased risk of having impotence, of having headaches, of having daytime sleepiness, of having fatigue, of having impaired concentration or memory issues. So if you're suffering with some of these, we need to go see our regular doctor, have a full exam, and have the sleep study. Schedule a sleep study and have it. And if you are determined to have this illness, I encourage you to utilize the CPAP machine. If you do not do this, then you are putting yourself at increased risk of having a heart attack and a stroke. So with that, ladies and gentlemen, I'd like to say thank you so much for tuning in today. If you'd like to, you feel free to follow me on facebook.com/Celeste MD. That's facebook.com DoctorCelestemD. We have a couple of guests here with our Facebook Live today. Lila in London, say hi.
Hi.
And so we are excited and getting ready to have some fun on a Sunday afternoon. So excited to share with you guys today. Please share this with your loved ones or anyone you think that could benefit from this. Have a wonderful Sunday afternoon, and we look forward to empowering you again on next Sunday. Thanks so much. Have a good day. Happy Sunday, guys. Bye.
Happy Sunday. Bye.
Happy Sunday. Bye.
Bye.
Okay. Hi, Cassidy.
Hi,
say hey.
Cassidy.
Say hi to cousin Cassidy. Hey, Cassidy.
Hi, Cassidy.
Okay. Bye. Have a good Sunday, guys.